And welcome back. Well, there is no doubt we are in the face of a local and national nursing shortage. And even more significantly, there's a lack of help in mental health care. Well, the Milwaukee County Behavioral Health Division is taking this problem head on and is on a mission to find the right people who have what it takes to care for the most underserved population.
Yeah, we are here now with Mike Lappen from the BHD along with Jeff Munz. He's a pediatric crisis services manager. He's also what they call, sorry, I just lost my mic here.
There it is. A second career nurse, that's what they call him. Previously, Jeff spent 20 years in the construction industry. That's why you're wearing the orange underneath, right?
Well, exactly. I want to bring that out too.
Great to see you. Thank you guys so much for being here. Let's talk a little bit about the campaign and what it's all about.
So at the Behavioral Health Division, we closed some long-term care units several years ago, and it led to a community perception that we were closed. And so we were finding it a challenge to recruit nurses to our hospital because the community felt we weren't there. And then, as many have discussed, there's a national shortage of nursing, especially psychiatric nurses. So we felt we needed to start a campaign to create public awareness around the fact that we were open and that we were open in hiring and that we provided a pretty unique opportunity for people to learn about mental health and substance use care in an inpatient setting.
Yeah. So as the administrator for the Milwaukee County Behavioral Health, how do you describe behavioral health and what does it all entail?
Well, the way we think about it is that behavioral health is just part of everybody's health, that everybody has experience of a mental health challenge or anxiety or depression in their life, and at some point it can become unmanageable and you might need that level of care that we provide in our inpatient units, and Jeff's really the expert.
Yeah, and you're what they call a second career nurse. You were doing construction before, as Tiff mentioned.
Yes.
I would think that mental health nursing is much different than being an RN at another type of facility or place.
Sure. So mental health nursing does involve some different types of skill levels that we do teach during the orientation process at our facility. But it's really about compassion and care for the individuals. And our establishment is an acute psychiatric care facility. So we're getting the patients that come in that are in crisis and really don't have anywhere else to turn. And at that point in time, it's for us as nurses, we're running into the fire, so to speak, but we have to be able to go in there and then use a lot of compassion and care to sit back and treat those individuals and try to be their, not necessarily their parent, but kind of like embrace them and help them through their crisis situations.
Yeah, let them know they're heard, they're seen. Today is Children's Mental Health Awareness Day. How has your experience, I guess, differed between youth and adults?
Well, when we're working with children, we have to really look at the growth and development of that child and how important that is in everyday life.
Because what ages do you work with?
So the children that I work with is generally from about the age of 7 through 18.
Okay.
And they're coming from environments that aren't really necessarily the best environments. So they might not have proper heating or food in their house, or they could have parents that are going through their own type of substance use or alcohol addictions and things like that. So they don't have the best environments. That leads to some of the trauma that they're dealing with. And so that when they come into our facility, we have to obviously attack that as the main focus of what we're going to help them with and try to help them understand the stressors of life and how to kind of combat those stressors.
Some coping skills.
Yeah,
exactly.
for sure. Yeah, and I would think you have to address the mental health before you can even start thinking about healing the physical self, which I think is an important point. This is National Nurses Week. People are familiar with the fact that there's really a shortage of nurses, and maybe particularly in your field. Who would be an ideal candidate to be the type of nurse that you are?
Well, you have to have strong communication skills, and you have to really want to give back to the community. You have to want to fight the stigma of mental health. And so many of us realize that it's a part of our extended families or friends and relatives in the area, that they realize that they have that inside of them. Not anybody can come into this. We have part of our campaign is if you don't have what it takes, you need not apply. Because it is a tough situation to go in and, like I said, work with people in an acute psychiatric facility.
Yeah.
But we are willing to take people in and train them the best that we can and kind of show them what they need to do the job as well. So we're looking forward to people that want to give back to the community.
Yeah. What would you say is in it for them as you kind of look for, those who want to follow in the footsteps of Jeff?
Well, we're very competitive. We offer signing bonuses and tuition reimbursement or student loan forgiveness. But I think the really biggest point I'd want to make, and I think Jeff would agree, we provide an opportunity for individuals to really get cutting edge experience in mental health and substance use care that no matter where their nursing career takes them, that will be invaluable. And people are starting to understand that mental health really, and as I mentioned earlier, can happen to anybody. Anybody can experience a mental health or substance use crisis or have a family member. And so having that knowledge to apply to your entire nursing career is really an amazing tool to have, and it will make you a better nurse.
If someone's listening and they think maybe they want to consider it as a second career, maybe they're nursing already but haven't considered this particular field, how does someone apply?
Well, real quickly, let me just mention that on May 15th, we have a job fair, Tuesday, May 15th at our facility. So that would be one place that they could stop by next week, Tuesday, and see the job fair and apply that way. Otherwise, we do have Milwaukee.gov/nursing is another place that you can go and witness some of our other nurses. We have like some formats of watching some film of myself and how I got there, and some of the other nurses.
Neat.
So you can kind of like see the background, see
Yeah.
what it takes to be in this market, and that'll give you a little bit more of an insight as to what we do.
Yeah,
great.
I think it is great. It's nice to understand it a little bit better and then hopefully take part as well in the nurse job fair. That's coming up again Tuesday, May 15th. It's from 2 to 5 p.m. You can learn more by visiting the website that Jeff mentioned. It's Milwaukee.gov/nursing. There's more information there as well so that you too maybe can be a second career nurse.
Where is your facility if people are interested in attending the fair?
9455 Watertown Plank Road.
Okay,
is the main
perfect. Great. Fantastic. Great to see you again.
Get the wave, right?
Join me in my nursing, right?
See you all there real soon. Yeah, exactly.
Sounds good. Thank you both so much.
Thank you very
We
much.
appreciate it.
Thanks.
All right.